Yeah, it's gonna go, yeah, it's gonna come down to the lower limb. Uh-huh.
Now there that it.
Yeah. So this is the second branch.
Fingers through the face.
Must be two. Yeah.
It goes through the infraorbital foramen and then it goes through the rotundum.
Right.
I'm just writing
Because it's
the
going,
go here, then go here.
feedback from outside going in. Cheek in.
Yeah, and it's gonna come out through right there. Actually, wrong one. There.
Okay.
And there. I had this here over. Okay? So, the second branch goes through the infraorbital foramen, across a gap, and enters into the skull via the foramen rotundum. Now, you'll notice that these openings kind of form a crescent shape, all right, that follows this greater wings here along the sphenoid, the sella turcica. So the next opening is farther back, a little bit more lateral. Notice it's oval. It's a little bit larger. This is because the nerve is larger. We actually have all the motor nerves going to your chewing muscles as well. This is for the third branch, foramen ovale. So mental foramen from the jaw, behind the jaw, up into and through the foramen ovale. Okay, anybody have trouble finding that one? Yes.
Would it be okay to say ovale foramen or does it have to be foramen first?
Oh, I'd accept it either way. Yeah. Right there, yes. Yeah. Now, right lateral, as I'm walking around at the same time here. So if we curve around even farther, you can see a tiny little hole, and that is the foramen spinosum. That is for a blood vessel. It's not carrying blood to the brain, but it's carrying blood to the dura mater, the membrane that surrounds the brain, the meninges, and so it's known as the middle meningeal artery, and that's going to pass through this foramen spinosum. When you look at that foramina, those foramina, you'll notice that, especially on the side here, there's thin grooves in the skull, like a worm was kind of eating its way, or a bug beetle under the bark. But it branches up and along, kind of you can see a little bit here, along the bone. And as this artery is there, when the bone tissue hadn't yet ossified, and it ossified being depressed by that bone, that groove there, and so along the side, you can see the groove for that blood vessel. Okay? So the foramen ovale, the large oval one, and then the tiny little hole right beside it is foramen spinosum. Okay? Now remember we talked about, there's a groove right here, that artery. So remember how thin the squamous region of the temporal bone is? Okay, you have a really tiny foramen spinosum. Look at that deep groove there. So that's foramen ovale. So that thin portion,
Because we're in the
thin portion is easily broken. And what it is a blood vessel is torn unlike your skin, the skull can't swell out. And so what happens is the pooling of blood pushes the brain in. This is soft tissue. And that is a form of putting pressure on the brain. There was an actress, she was in the new version of Parent Trap 10, 15 years ago when Lindsay Lohan was little. She was skiing with her family in Canada and fell and went back to her hotel and ended up dying from the pressure on the brain because she had torn blood vessels and the pressure just built up. So O'Valley is there, Reynoson is there, okay? And so I read an incident about a young man, he was about 14 or 15, so probably in Babe Ruth baseball, and he was at baseball practice, and they were just lobbing the ball back and forth. When you warm up, you start close together, and you gradually move farther and farther apart. So it wasn't an actual game, the ball wasn't being thrown with great force, and he had turned his head for some reason, and the ball hit him in the squamous region of the temporal bone. And the coach, being a conservative coach, decided to take him to the ER and called the folks and said, hey, you know, I'm sure it's fine, but I just wanted to let you know I'm taking him to the ER. And they got seen fairly quickly. And about half an hour after the accident, he was being examined, and the doctor said, so tell me what happened. And this is why you, as parents, don't jump in all the time and explain things. You let, if they can talk, you know, let the child say what's going on, or your older parents or whatever, because that's part of the process of seeing what they say. And the kid said, well, I don't really remember it. I think I fell off my bike. And the coach was like, what? That's not what happened. And so he had already was having bleeding occurring deep to the skull from the skull fracture, and that was causing neurological deficit because of the pressure on the tissues. So they took him into surgery to relieve the pressure and make sure the bone plates were okay. And his potassium levels came back from the lab, and they were extremely high. And the surgeons had already noticed how very brittle his bone was. And that's why such a light force in the throw had caused the fracture. But they didn't expect such high potassium levels. And so they said, run the test again. And the lab said, you know, we already saw that they were high, and we've already run it 3 times, and these are the accurate results. And as it turned out, he had stage 4 kidney cancer. And we talked a little bit about vitamin D and the kidney's role in activating calcitriol, a form of vitamin D, and that regulates calcium levels. And he had the brittle bones of an elderly person. And so he had no other symptoms of the kidney problems. This was the first that they saw of it. And so they were able to remove the kidney, and he had the one functional kidney that remained. But he had no other symptoms. Being young, his body was, the other kidney was able to handle the workload.
He really got hit.
Yeah.
Those which took him, usually they just.
I know, I was kind of surprised. It's like, yeah, you know, lob on the head, you know, we'll watch you and
Had plenty of times.
make sure everything is okay. That my son was, when my oldest son was in 4th grade, I picked him up and we're driving home, and the twins were just infants, and I said, or young, and I said, so how was school today? You know, typical parent question. And he said, I don't know. And I said, what do you mean? He says, I don't remember. And I said, you don't remember? He said, yeah. He said, I was playing after school and I got hit in the head. I was like, what? He said, yeah, I got hit in the head. I was chasing this kid and he suddenly turned and ran right into the side of my head. And I said, well, what happened then? He said, well, when I came to, I was sitting against the side of the building and the kids were asking me what my name was. And I said, well, none of the teachers said anything to me, none of the teachers that had yard duty. He said, well, we didn't tell them. So I said, we're going to turn around and go back and find the kids that you were playing with. Because there were some older kids, and I talked to them and I said, okay, you guys aren't in trouble. You know, I'm not trying to scold you, but when this happens, we need to know because Chris has baseball practice tonight. And I'm not gonna let him play practice because he might get hit again. And you don't wanna get multiple, concussory hits like that in a short period of time. And I need to know if he gets drowsy and sleepy and doesn't wake up easily, what that means. So again, temporal because of its thin bone, but the middle meningeal artery is passing through the sphenoid bone, and then it branches out to supply that tissue. Okay? Now, while you're looking in this area, you will see the groove for the carotid artery. On some of them, it's more pronounced. So remember, it's coming through the carotid canal and the temporal bone and traveling through this canal that opens up and travels onto the side of where the sella turcica is. And there's this large opening right here that you can put a stick through or your pipe cleaner. Nothing actually passes up and down through that. So I'm not requiring you that you know the name of it, but everybody's going to say, well, what's this? It's foramen lacerum. And what happens is it's like a well, and the carotid artery just goes over the top of it. Okay? Nothing actually goes up into or out of the skull. So that large opening that you see just as the carotid canal is opening up is just an opening. It's not a structure that's right. Yeah. Okay. That's the sphenoid bone. Okay. Yes.
Does the 3 levels of the cranial cavity have names?
They do. You don't have to know them, but it's the frontal fossa, the temporal fossa, and the occipital fossa, and they receive the lobes. If you look at the
We talk about that a lot in Broken Arrow. It's funny things. Yeah.
if you look at the brain, it has 3 levels as well. So if we turn it up like this, the frontal lobe rests on the frontal fossa, the temporal lobe rests in the temporal fossa where the greater wing is, and the cerebellum rests in the occipital fossa. So it's that step shelf up here. Okay. We have one irregular, difficult child to deal with yet. And that's the ethmoid bone. Okay, we have other bones, but this is the next one that's a little complicated in shape. So in this view, we're looking at the green bone. Okay? So I'll turn the light off in just a moment. And I'm going to draw it on the board because the actual bone itself, when we look at it alone, is not very clear. But this one has multiple processes. So the temporal bone, the sphenoid bone, and the ethmoid bone are typically the ones that you'll see most common, not the only ones, where I'll say all the following are a process of the sphenoid bone, except, okay, because there's so many of them. Or all the following are a process of the ethmoid bone, except. You can see this bone from primarily 3 locations. We're not going to see it from the outside because it's the middle bone. So if you look at the nasal cavity, for many of you, this thin plate right here that helps to form the nasal septum is absent. It's broken out. But that's one process, this vertical process called the perpendicular plate. And then we have 2 shell-shaped kind of coiled pieces of bone that hang down into the nasal cavity. Sometimes they're called turbinate bones because they disrupt the flow of air and they warm it, add moisture to it. We'll cover that when we do respiratory system. But there are 2, the middle one and the very high in the nasal cavity, the superior. We can also see the ethmoid bone where it forms the medial wall, part of the medial wall of the orbit. I wouldn't recommend it if you have fingernails, because all of you do. But if you push your fingers deep into the orbit and pinch it, you can do it on your skull without pain. You would be touching the ethmoid bone. On the real skulls, it's probably broken through, and you can see little tiny air channels. So this is our next sinus. The ethmoid sinus are these air spaces that are forming the lateral walls here of the lateral components of the ethmoid bone. And then the next place to see the ethmoid bone is looking inside the skull from the top. right here. So it forms an island in the middle of the frontal bone. Alright? So I'm going to draw this on the board, and I'll put the real bone picture up here. And it looks a little complicated. So what you're looking at is, here is the perpendicular plate. Here is that part that you're seeing inside the skull from the top. Here are the concha, and here are the air cells. Okay? So I'll draw in green since those are the colors on the skull. And I usually think of it in this fashion. So this is that sharp structure that you see inside the skull, all right, that looks like an upside down keel. And if you continue that down into the nasal cavity, it forms a perpendicular plate, all right. So this is like a frontal section that I'm drawing. And this is called the crista galli. It forms the attachment for the meninges to kind of anchor the brain in front so it doesn't shift around too much. And then perpendicular to that, with openings, again, this is in the back of the top roof and posterior aspect of the nasal cavity. So these openings allow your nerves for smell to pass through and into the skull. So this is the cribriform plate. Olfactory nerves. And then perpendicular to that, down in the nasal cavity now, because this is in the roof of the nose, we have the perpendicular plate. Forming part of the nasal septum. All right, so that's what you're seeing right here. Then we have the conchae. We have three sets of conchae, okay? We have the superior, which is really small and can't see it from the front because it's up high and in the back. We have the middle nasal concha, and then we have the inferior. The inferior is an entirely different bone. It's not part of the ethmoid bone, okay? It's its own bone. So now if we add in the concha, we would have superior, concha meaning shell, like a conch, and then the air cells or ethmoidal sinuses are going to be up here where we form the orbit of the eye. So they would be covered by a smooth surface, which is the surface of the eye orbit. And these would be the ethmoidal air cells or ethmoidal sinus. So those are the processes of the ethmoid bone that you would associate with it. So what we're seeing here is the perpendicular plate and the middle nasal concha. Superior is so high up in here, and then posterior, we can't really see it very well. Okay? And then if we look at the, look down inside it, one of these bones will, come on. Oh, Here's a good view. So here would be the crista gala, and here's the perpendicular plate.
It's long this way.
It runs the whole length. So if you look at the front of the skull, you're seeing this bone at the very bottom. There's like a bump right there, and the rest of it may be broken out. But this bump that you see at the bottom belongs to a different bone called the vomer. And if you turn the skull over and look at this view, you can see more of the vomer here. Remember, but when you found the pterygoid place, I told you to right in the midline. So what you're pinching right in the midline is the rest of the nasal septum formed by the vomer. And those two come together in a pattern that I'll draw for you on the board, like this one here. In a moment. I keep forgetting which way I'm going here. So when we look at the nasal septum, we have the two processes, two bones doing this, right? So the ethmoid bone, this would be the perpendicular plate. Of the ethmoid. And then the vomer does this. And the gap in the middle, what you're actually feeling here, is cartilage. So when we look at the skull, that's cartilage, that soft tissue, it's gone with these prepared skulls. Okay. So that's the view you're seeing here. So, crista galli, perpendicular plate, vomer, and then cartilage would be here. Now, looking at this view, I apologize. I realize I left off another sinus in the sphenoid bone. Okay, so since I have this view here, here's the sella turcica. All right, and some of you in your real skulls, there's a hole, it's broken through, and you can see a space that would be underneath, like the basement of the sella turcica. I think yours is broken through. Nope, it's not. That one's in yet. But on our, yours is kind of exactly here. I know I saw one 12 are in the same place as they were this morning. So, look right back here. Couldn't pack down.
There was a sign somewhere.
Maybe it's still up on the shelf.
Oh, like right
Anyways,
underneath
right,
the
right
depression.
in, right in.
Right where.
If you were to bounce up and down in your saddle too much, you might break through. So you got it. So this one has a tiny little hole in the floor of the sella turcica. When you look through that, there's a large space, about the size of a big cherry. And that's the sphenoid sinus. This is how access is gotten if someone is going to have surgery on a pituitary tumor. So I have a pituitary tumor. They're 99.99999% of the time are benign, which means they don't metastasize. So the main reason that there's a problem is if they grow up out of the sella turcica, they can put pressure on the optic nerve, which is passing over it right here. So that can cause visual problems. Or, depending on the cells that are growing too many, there might be too much of a particular hormone. And the pituitary gland regulates the adrenal glands and the ovaries and the thyroid gland and the testes, even the liver, okay, and growth hormone. So depending on which of those cells are cancerous, you can have additional problems. So my pituitary tumor is actually our first case study next in Bio 431, because we do endocrine and reproductive. And it started out as a hyperplasia of the cells that make prolactin, which is the hormone that you produce when you're pregnant and nursing a baby. And so at first, so I take a medication in the morning and at night, tiny little pill, and that keeps that in check. All right. If I were to have surgery, the access to the surgery to the pituitary gland is through the nose, break down the wall of the sphenoid sinus, break through the sella turcica, and then there's the pituitary gland, without having to go through actual brain tissue. It's still delicate enough because you've got some cells up here and some cells to the side. If they don't get enough, all right, then they have to go back again and do it again. If they take too much, then you've got the opposite problem. And so a surgeon, to be good at this surgery, needs to do about 300 a year. Somebody has to be the first 100 that he did or she did in their life. Okay, so I've decided that with my medication, I'm perfectly fine. I don't seem too strange to most people. And so I decided I really don't need to have that done yet. So, sorry for going out of sequence, but just remember that we haven't talked about that yet. So you can't see the ethmoidal sinuses here because remember they're forming the orbit of the eye. So they're going to be lateral, all right, to the actual perpendicular plate, which is in the most medial structure. Okay, we have a little bit more time with the afternoon class, so I think I'm going to stop there and let you guys have some lab time to study this material, and then we'll come back and do the bones of the face, okay? And we'll go ahead and do the quiz during this lab time. So let's have 7:30. Let's come back for lecture at 12:30, and we'll do the quiz at 12. Okay, so you'll have about 25 minutes. Actually, yeah, let's do the quiz at 12. Let's do a little bit. Let's do the quiz in 15 minutes, and then it'll take us to 12, and then you'll have a half an hour that you can study these bones rather than having a whole bunch of stuff at the end of lab, okay? And then we'll come back and finish up the bones of the face. So we'll do all of the skull today. So I'll pass the lab lecture exams back at the end of that second lecture during the second lab time. So we'll have a couple of lab times today. So quiz in